we keep getting a lot of inquiries about facial aesthetics and what options exist for patients to rejuvenate their face. So I thought me and Dr. Nikita, we were discussing the other day, and we thought it's a good idea to create a podcast around these treatments. So you said you have some questions to ask me.
Definitely.
Please ask.
So, on an everyday basis, we are getting a lot of non surgical and surgical queries regarding facelift.
Mhm.
So, we thought of clearing it out today. So, let us ask some frequently asked questions from Dr. Parag. So, the basic question that everyone has and come with the confusion is whether they should opt for a non surgical facelift or a surgical facelift, and what are the different options that we have in both the things.
So, whenever a patient comes for a consultation, we have to analyze the patient's face and see, face is like an elastic. If you take an elastic and if you stretch it, over a period of time, that elasticity is going to go, and the same happens to our face as we age. So, whatever tightness was there or whatever volume was there in the 20s is not going to be there in the 30s, definitely not in the 40s, and then in the 50s. So, aging is a combination of loss of volume and sagging. So, facelift is a surgery which will do both the things. It will tighten the tissues so the sagging is corrected, and plus it will give you more volume so that the loss of volume part is also rectified. So, if a person has a lot of laxity of skin, so if you make a person stand in front of the mirror and if you check the laxity of the skin, and if there is too much of tissue that accumulates here, then maybe it's time for a surgical facelift. But if someone is in 20s and 30s and there is just some hollow that you see in the mid face or some hollow in the under eye area, then maybe we can help them with hyaluronic acid fillers, and they don't immediately then need to go for any kind of surgery.
So, if a patient underwent non surgical facelift options like various Botox, fillers, threads,
Mhm.
so after that, do you encounter any difficulty in surgical option for facelift?
When we do a surgical facelift, we work at a much deeper level. So threads or any other non-surgical modality works at the level of the skin. And what we do in a surgical facelift is we deal with tissues which are deeper to the skin, such as the smash layer. And this smash layer is something which is not affected by what has been done on top of it. So when we do something, for example, like a deep plane facelift, it is totally not related to whatever non-surgical treatments that have been done. And I frequently see a lot of patients these days who have done threads, for example, and I don't see much of fibrosis in the plane that we work in. So I don't think it matters as much. But if you have recently done fillers, then it's a good idea to get rid of those fillers or have them dissolved before the facelift, because then it gives me a better idea of where the volume is really required, and we don't want to then overcorrect anyone's face by filling fat in some areas which there is a filler already present. So if there is a filler in certain areas of the face, better to dissolve the filler at least a week prior and then plan your surgical facelift.
So, on a everyday basis, we have seen you using different threads for non surgical facelift option.
Mhm.
So, what are the different threads available in the market that we can do for the patient?
So these days, companies have a lot of specific threads that they've launched. So there are threads which are specifically for the mid face. There are threads specifically for the eyebrows, which are smaller in size. So it again depends on the type of face that the patient has. If a patient has a lean face, then you may do floating threads, which have a single entry point and they don't have an exit point. If you have a patient who has a heavy face or a chubby face, then you need a stronger pull, in which case you will use threads which are bidirectional or with a needle at either end, because they exert a stronger pull. And now of course you must have seen that we use something called as a third generation thread. So a third generation thread is not only for tightening or lifting, it also is for bio revitalization. So the threads are embedded with hyaluronic acid, and when the thread is inserted, it also releases hyaluronic acid inside, so it also rejuvenates the skin. So it is all about choosing the right or optimal kind of a thread for a given patient, and yeah, we have a wide variety of threads to choose from.
So, what are the different types of surgical options for facelift available?
So if someone has only sagging of the middle part of the face, which we call as a mid face, then you can go for something which is less invasive called as a mid face lift. In a mid face lift, the incision is very small; it's only in the sideburn, and it's better concealed. So if you are young and if you have maybe lost some kilos of weight and the mid face is sagging, then maybe a mid face lift is a good option for you. If you are a little older, maybe in your 45s or 50s, then maybe it's time for a complete facelift. So in a deep plane facelift, the incision starts at the level of your eyebrow. It goes in the crease of the ear and then ends at the lobule. So again, it's a incision which is taken in natural creases of the face. It is not really something which is going to be visible a month or two later. And if you are someone who also has a lot of sagging in the neck, then the same incision continues behind the ear, and that's where we do the neck lift from. So whether you are a good candidate for something like a minimally invasive facelift, a max lift, a mid facelift, or a complete facelift would really depend on the amount of sagging that one has. The recovery time is of course going to be little more the number of procedures that we do, and more than the face and the neck, the eyelids tend to take a little longer to recover because the eyelid skin is very delicate. So if you do a blepharoplasty along with your facelift, it will take around 2 weeks for the swelling to subside. But there are different types of facelift, so it is really a very flexible kind of an approach that we should have when we get a patient for a surgical facelift.
So our next question is, what are the risk factors associated with surgical and non-surgical facelift?
So any procedure when it is done in the proper plane and with the proper knowledge of the anatomy is very safe. But if the threads are, for example, not inserted in the correct manner, or if there is an injury to the blood vessel, then there can be bleeding, there can be hematoma formation, there can be injury to any nerve. And similarly with the surgical facelift, if you are in the correct plane, these surgeries are very very safe. And of course you know that the branches of the facial nerve run on a deeper level, and when we do a deep plane facelift, we stay above the nerve branches. We use magnification, we use good illumination, so the nerves are safeguarded. But some of the common complications that are documented in literature after a facelift surgery include collection of blood, which is called as a hematoma, bruising on the skin for few weeks. You can have accumulation of fluid, which is called as seroma, and of course infection in the suture line, necrosis of the skin. So these are the common problems that have been described. But after doing hundreds of facelifts, I can tell you that as long as the surgery is done in the appropriate plane and with the proper expertise, the surgery can be truly very satisfying and with the minimal of risks.
So thank you for today's podcast session. I hope all the doubts and queries are cleared. If you have any other query remaining about overall face rejuvenation, facelift, or anti-aging treatments, you can comment us below.
Do like and share this video and subscribe to our channel to get the latest information. Thank you.